Have you ever wondered why pregnancy places more stress on the heart than almost any other normal human condition? Pregnancy is not just a reproductive state, it is a state of profound cardiovascular adaptation. From the very moment conception occurs, the maternal body begins preparing to support a growing fetus, and the cardiovascular system is the first system to respond. This is because every other adaptation in pregnancy, oxygen delivery, nutrient transport, waste removal, and placental function, depends entirely on blood flow. One of the earliest and most important cardiovascular changes in pregnancy is a reduction in systemic vascular resistance. Pregnancy hormones, especially progesterone and estrogen, cause widespread vasodilation throughout the body. Blood vessels relax. The smooth muscle in the vessel walls becomes less constricted. And as a result, peripheral resistance falls. When resistance falls, blood flows more easily through the circulation. And because blood is now facing less opposition, blood pressure may actually decrease during the first and second trimesters of pregnancy. This is why many pregnant women have slightly lower blood pressure early in pregnancy, even though their bodies are already working harder overall. And if this is already making pregnancy physiology clearer for you, pause here, save this video, and follow EliteMedicNexus. Because everything that comes next builds directly on this foundation. At the same time that blood vessels are dilating, another major cardiovascular change is occurring. Blood volume is increasing. Plasma volume begins to expand early in pregnancy and can increase by up to 50% above pre-pregnancy levels. Red blood cell mass also increases, but not to the same extent. Because plasma increases more than red cells, the blood becomes diluted. This leads to what we call physiological anemia of pregnancy. This is not due to blood loss. It is not a disease. It is a normal and necessary adaptive process. The hemoglobin concentration appears lower simply because the liquid portion of blood has increased more than the cellular portion. This expanded blood volume is absolutely essential for pregnancy to progress safely. It ensures adequate placental perfusion, allowing oxygen and nutrients to reach the fetus efficiently. It supports the steadily increasing oxygen demands of the growing fetus, and it provides a protective reserve against the inevitable blood loss that occurs during delivery. So when you see mild anemia or lower blood pressure in early pregnancy, these are not abnormalities by default. They are often signs that cardiovascular adaptation is occurring exactly as it should. But here's the key clinical insight. If you do not understand these early cardiovascular changes, you will misunderstand almost everything that follows in pregnancy. You will misunderstand why hypertension typically appears after 20 weeks. You will misunderstand fluid balance, edema, and volume overload. And you will misunderstand why some patients suddenly decompensate when these adaptations fail. Normal pregnancy physiology is the baseline. Pathology is what happens when adaptation goes wrong. That is why cardiovascular understanding is not optional in midwifery. It is foundational. Because once you truly understand how and why the cardiovascular system adapts in pregnancy, you can begin to predict complications long before they become emergencies. And this is only the beginning. Follow EliteMedicNexus, turn on your notifications, and stay with me. Because in the next lesson, we'll build directly on this to explain where and why things start to go wrong.